PRF is platelet-rich fibrin. That's a regenerative therapy that can be utilized to help the body heal and recover to its original state of health in a much faster way. So let's go back to the basics. So the body has an inherent capacity to heal, and the way that happens is if, for instance, you cut your skin, the first thing the body's going to do, it's going to call in platelets to that area. Platelets' job is to clot the blood, so they stop the bleeding. The next thing that the platelets do is they release something called growth factors. The growth factors get released from the platelets. Those growth factors are designed to increase blood flow, cause migration of certain cells, particularly stem cells, and also to help with proliferation of those cells to heal the body back to its original state. Why after a year that you've cut yourself, you look at your skin and you don't even know where the injury was? It's because those stem cells that were called in by those platelets cause those skin cells to regrow and regenerate to look exactly like the body did before. Now, sometimes in other injuries that are deeper in the body, in ligaments, tendons, muscles, and joints, sometimes the body doesn't always get 100% repair, and therefore you may end up with scar tissue or chronic injury and chronic pain in those areas that were injured that did not completely heal. In this case, application of regenerative therapies can be very useful to try to bring the body back to its natural state and try to attain close to 100% healing in order to have better functionality and reduced pain and overall better dynamic movement. So I first started using regenerative techniques utilizing PRP, which is platelet-rich plasma. I then learned about a new technique called platelet-rich fibrin, and that's utilizing a different technology that will concentrate those growth factors in the maximal way. Those are very powerful for regeneration, and their healing potential is far greater. PRF is made up of three main growth factors. The first one helps with increasing blood flow. The second one is involved with migration of stem cells that are actually in the surrounding tissues to come to the area and help the body regenerate back to its original state. And the third one is involved with proliferation, where those cells multiply, and now we can get a faster recovery with shorter healing times and near 100% recovery to the body's natural state. So think about it. If you've had an ankle sprain and it did not heal 100%, then there's a tendency to have that sprain recur over and over again. It takes less and less trauma to make the same injury occur. With the application of PRF to that ankle sprain, we can see near 100% recovery and a reduced tendency to have that recur in the future. So how do we accomplish regeneration with PRF? So the first thing we do is we draw your blood, we spin the blood down, then we extract those growth factors. Often we will use ultrasound. We can use the ultrasound with pinpoint accuracy to identify the area of injury, and then we can use the same ultrasound to help guide the treatment with those growth factors right into that injured structure so that we can get faster recovery. How many times does one need to be treated? It really depends on the acuity of the injury. So if the injury occurred just a few weeks ago and it's a mild injury, often we can get by with one, maybe two treatments. If it's more of a long-term chronic injury like arthritis of the knee that's been going on for 20 or 30 years, that can take 3 or 4 sessions in order to get the patient back on their feet walking and running the way they used to. Ideally, a patient would come in shortly after an injury has occurred so that we can apply the therapy early in the injury to get faster recovery, but we can also apply the same regenerative techniques to longer-term injuries or long-standing issues like arthritis that took years to develop. You've heard me mention stem cells and the ability of these growth factors to help with the migration of the stem cells. And I know that stem cells can be a very polarizing subject because there's controversial application of certain types of stem cells. So personally, I would not want to take a donor's cells into my own body, and I would not want to use that for my patients. So we prefer to use one's own blood because it's actually coming from your body, which is going to help you to heal. If you're interested in learning more about this treatment, go to the website or give us a call and we'll be happy to help you.